Welcome everyone to part 8 and the final part of Unit 8, Clinical Psychology. So what we are going to be talking about today is biomedical therapies. And then we're also going to be talking a little bit about preventative psychological or preventing psychological disorders at the end here, but mostly focusing on these biomedical therapies. Now again, remember, one thing that's really important is remembering the difference between biomedical therapies and psychotherapies that we've already talked about. So first thing we want to do again is just remind ourselves what we're talking about when we're talking about biomedical therapies. So biomedical therapies, and there's kind of three different groups of these, right, are treatment that changes the brain's chemistry with drugs, it's circuitry with electrical stimulation, magnetic impulses, or psychosurgery, or influences its responses with lifestyle changes. So there's three kind of main groups of biomedical therapies. There's drug therapies, brain stimulation, and psychosurgery. And we'll talk kind of about each one. Okay, so again, drug therapies, brain stimulation, psychosurgery. Again, the whole thing, and to kind of like summarize biomedical therapies in general, is we are, you can obviously see kind of the bio aspect. We are going to change some aspect of the biology to then deal with whatever disorder we're dealing with. So we're changing the chemistry, we're changing the circuitry, to then cause a change in that person's behaviors, thoughts, feelings, whatever they're dealing with. So the first thing we want to talk about is psychopharmacology. So psychopharmacology is a really, really big field. It is the study of the effects of drugs on the mind and behavior. So obviously when we're talking about drug therapy, this is a massive part of medical therapies. It's actually the most widely used biomedical therapy. So most likely, if you have a psychological disorder and you go and you're going to get some sort of medical treatment, as opposed to, and again, you might get both medical and psychological treatment, but if you go, it's very, very likely that you'll get some sort of medication, right? You'll get some sort of medicine that you take, and that will then hopefully cause some sort of changes that will, help you deal with this disorder. Again, psychopharmacology is the study of these effects. So looking at different medications, looking at different drugs and seeing, okay, how do these affect the mind? How do they affect the behavior of these people? So what we're going to look at now is different types of drugs. So we're not going to go super, super deep into them. We're just going to kind of give you a general overall look at what these are. Okay, so first we have antipsychotic drugs. So antipsychotic drugs are drugs that are used to treat schizophrenia and the other forms of severe thought disorder. So psychotic disorders, right? It makes sense, antipsychotics. Now, most of them, and again, we're painting these very broadly. Obviously, when we're talking about medications used to treat something like schizophrenia, there's a whole bunch of them, so they all might work a little bit different ways. We're going to see that the same kind of idea with the different parts, but most are going to interact with dopamine receptors to treat the positive symptoms. Again, we talked about how in people with schizophrenia, we tend to see this overactivity in dopamines and their how much dopamine is flowing through them, or they're releasing, or how much is being received, right? So what we're going to do is we're going to create a drug that's going to interact with these receptors. Okay, and by doing that, we can then try and get rid of and treat these positive symptoms, which again is obviously a really big part of schizophrenia for a lot of people. Now, one thing that's kind of important is that these antipsychotics are not as effective on negative symptoms. So what and again, this may be why, if you have something like schizophrenia, you may have multiple different types of medications you're taking to deal with all the different things. Sometimes you might not be able to treat everything with medication specifically. But you can see how, okay, if we have different pieces, okay, this is going to go in, it's going to stop these dopamine receptors from maybe receiving as much. That's going to then kind of get rid of or calm or slow down or kind of mute a little more these different positive symptoms. And then we do other things to treat maybe the negative ones. Next, we have anxiety drugs. So anxiety drugs are drugs used to control anxiety and agitation. Probably makes pretty good sense. What these are usually going to do is depress central nervous system activity. So when we talk about anxiety, Anxiety is caused by an overactivation of the central nervous system. The brain is kind of like the central nervous system is basically going too much. It's overreacting, right? So what we're going to do is we're going to try and slow it down a little bit. We're going to depress it a little bit. So that is what things like Xanax and Ativan. Xanax obviously is a really, really big example. That's what they do. They're depressing that central nervous system, and that then calms that person down, right? Because it's slowing it down. Some things with anxiety medication, anti-anxiety medication. One is that these can definitely be addictive. So obviously that's an important thing to take into account when we're talking about how we're going to treat different things. So they can definitely be addictive. And some people argue that they actually create a really poor learned response. So if I'm a psychologist, obviously one of the things I have to think about, when it comes to medications is what else is this person learning through this process, right? So one of the big kind of criticisms, I think, of something like Xanax or using anti-anxiety medications is that I kind of teach this person this response that when I get anxious, I should take a medication, right? Now, for some people, that's just that might be a necessity, right? We might need to do this. But it also teaches them this reliance on that medication. And that's something that obviously people can be anxious about or nervous about, right? Going forward is, if you learn that when something makes you feel a little anxious, this is what you do, right? That means you're going to do it more and more. Obviously, we have this aspect of then being addictive. Now, is that going to then cause, more negative consequences down the road, right? So you can kind of see how there's obviously other pieces that need to be taken into account. Next, we have antidepressant drugs. So antidepressant drugs are drugs that are used to treat depression, anxiety disorders, obsessive compulsive disorder, and post-traumatic stress disorder. So kind of a broad group here. Now, these ones are a little bit more variable in how they actually work. But many of them work by increasing the availability of norepinephrine and of serotonin. Okay, so again, serotonin is very much connected with mood, very much connected with feelings of positivity. So if we are increasing how much serotonin is available, right, that's going to then make us maybe feel better and make us less depressed, right? Thus, antidepressants. Norepinephrine is something that is released when we feel stressed. It also dulls pain. So again, it's something that will hopefully help us kind of increase that mood a little bit. One thing we know about antidepressants, though, is that they do come with a variety of side effects. And really, I don't want to say all, but a vast majority of medications do come with side effects. But this tends to be a big piece when we're talking about antidepressants specifically. Next, we have what are called mood stabilizing medications. So mood stabilizing medications are generally used to treat bipolar disorder. As you can probably imagine, right? The big thing about bipolar disorder is these ups and these downs. It's not just dealing with just depression, but also the mania. And obviously, this is an important thing to take into account when we're treating someone with bipolar disorder. Giving them antidepressants may not necessarily be the best way to go because if they transition out of that depression into a mania, right, where their mood is incredibly positive, those antidepressants may actually cause that even to spike even higher, right? So for bipolar disorder, what we're going to use are these mood stabilizing medications. The most commonly used one and the only one that we're really going to talk about is lithium. Lithium is actually just a salt, but what it does is it basically mellows out the highs of mania and slightly brings up the lows of depression. And so again, what we're trying to do is, we have these kind of peaks and valleys of bipolar disorder. What we want to do is basically just kind of bring those down a little bit, right? Try and bring them down where they're closer to kind of center. As you can kind of tell, lithium works a little bit better at treating the mania side. So obviously there may be things that we want to do in addition to deal with depression, right? It does help a little bit, but if we need more, we might try to find something in addition to work. Next, we have brain stimulation. So again, we kind of just looked at just those medications. Obviously, we're going super, super broad. And there's obviously a whole variety of other things that we could talk about, but those are kind of the general categories we would look at. What we're going to talk about now is brain stimulation. So brain stimulation is exactly what it sounds like. We are going to stimulate the brain. And the idea here is with most of these at least, is that by stimulating the brain, we're going to cause changes in the brain. And those changes will hopefully help people deal with these disorders, help kind of, I don't want to say cure people, but help them get better. Our first example that we're going to talk about is what is called electroconvulsive therapy. So electroconvulsive therapy is a biomedical therapy for severely depressed patients. And this is really important. This is only used on severely depressed patients. We're not necessarily going to do this for like a person who's a little bit sad, right? Severely depressed patients, in which a brief electrical current is sent through the brain to an anesthetized patient. So you go under anesthesia, so you're asleep, and they basically send this electrical shock through your brain, this electrical current. And what they see is that 70% of patients improve afterwards, which is obviously a huge number, especially when we're talking about severely depressed. These are not necessarily people, these are a lot of times people who maybe have even gone through therapy already who have not been able to overcome it, right? This is severe depression. So it's kind of extreme. One thing that's interesting about electroconvulsive therapy is that psychologists don't actually know why it works. We know it does work, at least on some level. 70% improving is pretty good. Is very, very good actually, but they don't really know why. So we're not sure what it's actually doing there, but it is causing this improvement. We can see other types of brain stimulation here. So we have what is called transcranial electrical stimulation, which is kind of similar to electroconvulsive therapy, but we're using a weak electrical current. So it's going to be a much, much weaker current. And again, it's going to be used to treat depression. We also have magnetic stimulation. I believe in the top right, that is an example of magnetic stimulation, that image you're seeing. What this is technically called is repetitive transcranial magnetic stimulation, or RTMS. What they're going to do here is they're going to send repeated pulses of magnetic energy to the brain, using it to stimulate or suppress brain activity. Now, again, obviously, you can think about, okay, in disorders like anxiety, where we're seeing an overactive brain, right? I might be able to use this to try and suppress it a little bit, right? Slow it down a little bit. In something maybe like depression, right? Maybe where I want to stimulate that brain. I want it to get it moving a little bit more, right? Maybe I would use this in the opposite way. So you can kind of see how what this maybe be targeted for. And then lastly, we have deep brain stimulation. So that image in the bottom right is deep brain. There's an example of deep brain stimulation. So what we're going to do is we're going to use electrodes. We're going to implant them in your brain to calm overactive areas. This is specifically working on depressed clients. So you can kind of see, I don't want to move my mouse because it's going to bring that little thing up, but if you look, there's those electrodes run down into, they're kind of putting it down into the kind of brace of the top of the brainstem there, right? Into kind of like that pons area most likely. And then they're going to, send in again electricity, right? That's what the electrodes are doing, to then treat what's going on. This example that we're looking at was used to, you can see it says deep brain stimulation for epilepsy. This was used to treat epilepsy. So it probably would look a little bit different than, what we'd see in depression, but you can kind of understand the idea of what they're doing, or at least where they're doing it. Next we have psychosurgery. So psychosurgery is, psychosurgery is pretty much exactly what it sounds like. It's surgery that is going to remove or destroy brain tissue in an effort to change behavior. So we're going to do brain surgery. This is what brain surgery is psychosurgery, same thing. So again, the idea here is we want to change behavior. So generally speaking, with psychosurgery, we're going to remove parts, or we're going to destroy certain aspects. We've already seen an example of psychosurgery when we saw earlier. We saw the the split brain patient, so he had his corpus callosum severed to deal with seizures. We saw it with those the children in the video, and I can't remember exactly what they had, but they had basically half their hemisphere taken out. Right, those are all examples of psychosurgery. The biggest example, the kind of most famous one, is a lobotomy. So lobotomy is a surgical procedure that was once used. This is not really used anymore. To calm uncontrollably emotional or violent patients. Again, this was kind of done obviously for more extreme measures. And what they would actually do was they would cut the nerves that can connect the frontal lobe to the inner part of our brain, right, our limbic system, that is the emotional controlling aspect. So actually what you're seeing on the bottom there, that image is an image diagram of a lobotomy. So that's the way they would actually do it. They literally lift your eyelids up. They basically took an ice pick, although I don't know if it was specifically surgically called an ice pick, but they would stick it up there and they kind of just like wiggle it around. Your brain is really soft, as we saw at the very beginning of the year, right? You can literally vacuum pieces out, which is what they do now a lot of times. And they would just kind of wiggle it around, and it just basically severs that part of the brain off. And this is what they would do to, again, treat these uncontrollably emotional or uncontrollably violent patients. So from there, we have preventative mental health and resilience. So there are also things that we can look at that can prevent mental health disorders and prevent challenges, or not, I don't want to say prevent challenges, but prevent us developing these different disorders. Now, again, obviously, this isn't going to like work on everything, but it's just kind of general ideas that we've seen that can have positive effects. So one of the things we know is that by making life more fulfilling and meaningful, we can prevent many mental health issues. So it tends to kind of be this case where, the better and more fulfilling and more meaningful someone feels their life is, the less likely they will be to develop mental health issues. We can kind of see an example of this in when we were talking before about Alzheimer's and the study that was done on those nuns, where they had a lot of the nuns, when they after they passed away and they were looking at their brains, they found that they had Alzheimer's, but they didn't seem to have any of the symptoms. Right, and one of the pieces with that may be this connection, right? That they felt that they had a very fulfilling and meaningful life that was social and cognitively challenging and rewarding, and so because of that, they basically just didn't have those mental health issues that we maybe would see in somebody who didn't have those aspects. So we can kind of see how those are connected. In addition, we can talk about resilience. So resilience is the personal strength that helps most people cope with stress and recover from adversity and even trauma. So resilience is kind of a big thing. It's basically this kind of idea that some people are just able to kind of recover from things better than others. So sometimes some people are just more resilient. I think an example of this is when we look at something like PTSD, where when people go through similar traumatic events, some people develop PTSD, some people don't. And it's not necessarily like, I don't want to say like it's like a weakness thing, but there's some people have different levels of resilience, right? Where they're just able to kind of deal with these different aspects. In addition, obviously, we talk about resilience once people do have a disorder, right? So people's strength that help them deal with that disorder that they have, deal with their mental health problem that they're struggling with. So you can kind of look at it from both sides there. And then we also have what is called post-traumatic growth. So post-traumatic growth is the positive psychological changes as a result of struggling with extremely challenging circumstances and life crisis. So post-traumatic growth is one of the things that's kind of like, I think you maybe could call it like the silver lining of mental health or disorders. And it's kind of this idea that after people have dealt with challenging circumstances or crises, and obviously dealing with a psychological disorder is very much a challenging circumstance or a life crisis. But when people have found the ability to deal with it, they oftentimes become much, much stronger, even than some people who have never dealt with it, right? And we can kind of see this in a lot of different examples. We see this in examples of people who, maybe have PTSD and then kind of are able to get through it and then end up helping other people with PTSD. We saw it when we were looking at schizophrenia with the woman in the video we talked about, right, where she was able to kind of find a way to live with and deal with her schizophrenia, and then basically also now become kind of a stronger person overall for it. So you can kind of see how it's almost kind of like the positive things you gain by dealing with things that are really challenging. Now, obviously, this doesn't mean like it's good necessarily to have gone through those things, but it's kind of like the silver lining that we can sometimes see there. All right, so that wraps up not just this section, but also this whole unit. Take some time and do a quick summary of this last section, and I'll see you guys next time.